This little video series is called Dying Dar's Way, Radically Real Spiels on the End of Life. I am here again with my friend Alison Hankinson, who is reading material from Samaritan Healthcare and Hospice. We are sharing, now that I'm coming closer to the signs that say we are nearing the end of life. We're not yet into active dying. We just want to share some information from the experts about what you can expect or what your loved ones can expect as you come closer to the end of life. So Alison is talking about the noises now.
Are you going to read the symptoms, or shall I read them?
You can start with symptoms.
Symptom: gurgling, noisy breathing. Often indicates changing condition. Call nurse.
Okay, this is important to know. There's some things that if you're on hospice, you're going to be able to do this, and if you're not on hospice, you need to, your caregivers, your loved ones need to know that attention is required.
Adjust head of bed. Position patient on side. Change sides every 2 hours to facilitate drainage if able. Use mouth swabs to clean mouth. Keep lips moistened. If after using above measures there is no change, call the nurse. May be difficult for family members to hear, but usually not stressful to the patient. Often occurs because throat muscles are very relaxed.
Yeah, and there's all kinds of floppy changes going on in there, and some of them sound quite alarming and actually may not be. Some of them we should be alarmed by.
The next symptom is hiccups. Instruct the patient to breathe slowly and deeply into a paper bag for 10 breaths at a time. Drink water slowly. Give patient 1 teaspoon sugar to hold in the mouth and then swallow. May be relieved by drinking peppermint water or taking Mylanta. Lower head of bed. May decrease pressure on the diaphragm. Notify nurse if persistent. Symptom: mouth sores. Notify the nurse if patient complains of very sore mouth or if white patches are present.
And I'm going to interrupt here for a moment. There is an awful lot of discomfort and dryness going on around the mouth. I haven't developed sores yet, but my mouth now is so dry at night that I literally feel the bottom is stuck to the top, and I have to work at it in the middle of the night when my caregiver comes and gives me the morphine. I literally can't unstick the roof of my mouth from the lower part of my mouth. So I think this business of odd noises and hiccups and strange gurgly sounds is just part of the typical process.
So notify the nurse if the patient complains of very sore mouth or if white patches are present. Use mouth swish as ordered by doctor.
Okay, we get little sponges on the end of a stick that you can moisten. Got to be careful with the camera. That you can moisten in order to provide some comfort and relief.
Clean mouth frequently, every 2 hours. Do not use a hard toothbrush or mouthwash.
I am severely at risk of being a bad girl and doing this because it is so uncomfortable that I want to be cleaning it and I want to be brushing my tongue, and I can't brush my tongue, and it makes me nuts.
Consider using room humidifier for patient who is mouth breathing, cause dry mouth.
Right.
Offer ice chips. Avoid hot fluids. Swab Maalox or Mylanta on ulcers to soothe mouth as ordered.
I'm finding, too, that my best home remedy is something that has some fat in it rather than just something watery. Like I've now been, what's it been, Alison? 2.5 weeks since I've wanted to take any nourishment except broth. I'm past desiring food, and I don't feel that I miss food anymore, but I want nourishment in the form of bone broth. I put seaweed in it. We can actually put a recipe in the program notes to go along with the video, because somehow water doesn't cut it. the hydrating little sponges and so forth don't cut it. I'm having my friends make me bone broth that has some seaweed, salt, and fat in it, because the fat is so much more soothing to the tongue than other things.
Of course you'll have a recipe that goes along with it.
Well, of course there will be a recipe.
Remove dentures if irritating.
Okay. No
Encourage bland foods, e.g. ensure cold foods, avoid citrus fruits.
Oh, I should mention, a lot of people are still eating at this point. That's a choice. I am very happy to not eat, but I can see these choices around Jell-O and citrus fruits and so forth are a very personal decision, and I shouldn't try to bias people just because I'm the one who feels like, oh, I'm done eating now, yippee. Whoever thought we'd hear Dorothy Mullen say,
She wasn't going to
I'm
eat.
done eating now.
But she's not done feeding everybody else.
No, still cooking.
Symptom, nausea. Can occur for multiple reasons. Is it medication related? Occur after meals? Occur with movement? Smell induced? Anxiety related? Notify the nurse if nausea is persistent. Offer small, frequent light meals or snacks, bland foods, Jell-O, puddings.
Yeah, clearly a lot of people still want to be on food at this point, and I have had it stressed upon me many times by the people in hospice that so many of the symptoms are hard to distinguish one from the other. Like, am I having nausea or am I having anxiety? It could feel like the exact same thing. I mean, who knew that they would be indistinguishable, feel indistinguishable?
Symptom, pain control. Give pain medications on schedule as ordered. Record times of breakthrough pain. Record doses so nurse can determine when dosages need to be increased.
Okay, and I'd like to break in here too. It cannot be stressed enough, and I had to learn the hard way, that you absolutely cannot let the pain get too far in front of you. You absolutely must medicate in time, because you can't chase the pain. In other words, you'll lose. You'll lose if you have to chase after pain control. And for me now, highly personal, I don't want to predict things for anybody else, but for me now, I'm on a 3 to 5 minute leash. If I get the sense that I'm going to have what I call a morphine breakthrough, it's time to take my opiates now, within 3 minutes, I will be getting twinges and suffering, and I would be screaming. I would be begging for death within 5 minutes. So you really are on a very short leash, and you can never be too far from your source of opiates.
See sheet on pain control. Provide comfort measures like massage, position change, soft music, ice, warm, moist compress, etc.
Yes, and I'm going to say, as Alison and my friends have all heard me say many times before, we remain intensely in character in hard times, and there probably is not many times that are harder than this, and the way we seek comfort is probably going to be something that's been comfortable and familiar before. I've always enjoyed being massaged. Now that extends very much into, I want to be scratched. Morphine is itchy. It's just so itchy to deal with these side effects. And so the way to my heart is literally through my chest, because now I have literally scratched open sores into my chest trying to get at an itch that I will never be able to scratch.
Okay, notify the nurse immediately if patient is unable to swallow pain medications.
Okay, there is a lot of this notify the nurse stuff right away. In hospice, they don't want you waiting around for everything. They don't want you waiting around for anything. They want you right on top of discomfort.
Remember, do not crush medications or open capsules unless instructed by the nurse.
Right. Okay. So I think we will do another section or two, and then we'll give ourselves a break and pick it up again.
Okay. This is pressure sores. Positioning, turning in bed. Be careful lifting and turning to avoid friction. Change position every few hours if you are able to do so. Use pillows or towel rolls to relieve pressure and provide comfort. Use a draw sheet across the middle of the bed, for moving and turning. Your nurse can show you how.
Okay, and I'm going to say something here that you can see my little orange pillow. It's actually a carrot back there. I'm always trying to find the currently most comfortable position and allow myself to seek comfort frequently in short doses, because the possibility of these bed sores and little pressure sores is very high the less mobile you are. And I have worked out this whole gamifying the dying process where I want things to be safe and comfortable, and I've made being safe and feeling comfortable a real priority. And one of the best things that you can do for being safe is to make sure that you're comfortable. So we do a lot of shifting around, to avoid the possibility of bed sores and so forth.
Well, it has to be said you're still very mobile, really.
And I'm still quite mobile, and part of that is because I still do 20, 30, 40 deep knee bends every single day. I still do little exercises where I push myself off the kitchen counter 10, 30, 40 times a day just to keep those muscles working, because if I don't have core strength because of the catheter in my abdomen, if I don't have strength in one part of my body, I can increase my flexibility in strength by working around the places where I do have this strength.
I heard you were doing yoga with Jamie the other day.
Yes, my son is an advanced yoga teacher. And he has been helping me like sweep my arms across the floor and go around this way and around that way, because if I can't do anything like a normal person does, like just even get up off the floor, I have to find ways to compensate. And there are positions in yoga that keep you in the game. Yeah.
Recognizing signs of change. Patient unresponsive. Notify the nurse if patient is unresponsive, so pain medication can be reviewed. Breathing may change by becoming noisy, faster, slower, or irregular. Urine output may decrease or become absent. Skin, lips, and fingernails may become very pale, blue, or grey, decreased circulation. Body surface may feel cool and sweaty. However, temperature may be elevated. May see muscle twitching and or random body movements. Hearing is one of the last senses to fail. Therefore, there is time to say those things you want to say. Continue to give explanations to the patient.
Okay, I'm going to stop us here. I made this mistake at my own mother's deathbed, and I am telling you, I regret it. 2 decades, decade and a half later, I regret the mistake that I made at my mother's deathbed. I didn't understand how keenly aware a dying person is of what's going on in the room around them. And I really missed my chance to do the final honoring of who she was, to be fully present to her as I could be, because she obviously had no choice but to be as fully present to me as she could be, because there was no taking potty breaks. There was no, there was no getting away from the situation. And I think that we'll stop there and say that when it comes to actively dying, heading in that direction, not quite there yet. And Alison is going to see me through the end with this thing. Thank you. I love you.
I love you too.